Hello everybody, my name is Dr. Manjula Disanayaka. I am a chemical pathologist by profession. Today I am going to talk on fasting blood sugar. This is a very common test. You are much familiar with this test. Therefore I thought of doing a video on this test to improve your knowledge regarding this test. This test is called fasting venous plasma glucose as well. That is the correct medical term we use for this test. Now you have to know why does a doctor request this test on you. There are two main reasons. One reason is to diagnose diabetes. If the doctor suspects diabetes in you, he may ask you to get this test done. The other reason is in the follow-up. If you are already a diabetic, then doctor may ask you to get this test done to see the glucose level as a response to the medication you are on. That is the other reason. Then you should know the patient preparation for this test. There's a preparation you have to do before getting this test done. We call it patient preparation. Now, one point regarding this patient preparation is you are supposed to fast for some period. It is actually an overnight fasting from evening to morning. It is around 8 to 12 hours fasting. The duration of fasting is around 8 to 12 hours. The first question you may ask from me is why? What is the purpose of fasting? There is a real indication, real purpose for this fasting. The reason is in this test we are going to check your endogenous glucose. Endogenous glucose means the glucose formed in you. We get glucose from outside. After a meal, after a couple of hours, your blood glucose level rises. This kind of glucose we call exogenous glucose. We don't want any exogenous glucose in this test. On the other hand, if you are fasting excessively, we call it over fasting. If you are over fasting, again it is not good, because when you are over fasting, lot of other metabolic activities which are not usual happens in your body to generate glucose, to keep your glucose level within the normal range. That is also not good. Therefore, as I mentioned earlier, if your fasting period is around 8 to 12 hours, by researchers they have shown that you will have only endogenous glucose. But some people, I know that some people have been told by the laboratories or various people, you fast exactly for 9 hours, 10 hours, 11 hours or whatever, then I think it is not necessary. If your period of fasting lies within this range, that is 8 to 12 hours, then you can go to a lab and get this test done. That's all. The other thing you should know regarding this test is, I told that this is overnight fasting. Why do we need overnight fasting? Somebody may ask, can't we fast from morning to afternoon? Because we are busy, we can't do this test, we are doing a night shift, something like that. Actually, the recommendation is overnight fasting. The simple reason is your insulin response is maximum in the morning. Insulin is the hormone which regulates glucose in your body. You have to get this test done when you have the maximum insulin response. That is in the morning. That is why we ask you to get this test done in the morning. Right. A person may ask, can I have water? Yes, you can have water during this test. No problem. But you should not get water in excessive amounts. If you take water a lot, your glucose may get diluted. That is why we ask not to get excessive amounts of water. But as usual, you can have your water, no problem. Then the other problem, other things you should know is the medication. A person may be on several medication, right? Before the test, the day prior to the test. Suppose you are going to the lab tomorrow, then tonight you may have several medications to be taken. Some medications before meals, some medications after meals. You can have all these medications as usual. Then the next day, that is tomorrow, you go to the lab and you are going to give the blood sample. Before going to the lab, there may be some medications for you that has to be taken before meals. For example, thyroxine like medicine. Then you can take those medications as well with some amount of water. After giving the blood sample, you can have other medications. Remember that you should never take medications like insulin and oral hypoglycemic agents, that is for the diabetes, before the test, because if there is any delay in getting the test done, then you may be hypoglycemic. That is the risk. Therefore, you have to take all these medications after giving the blood sample. Then a little bit about interpretation of the test results. That is also, I think, important for you to know a bit of interpretation. Now, when you get the report, if you have a fasting glucose value more than 126 or more than 126, that indicates that you are a diabetic. If your fasting glucose value is between 60 to 100 milligrams per deciliter, that means you are normal. If a person is having a fasting glucose value between 101 to 125, we call it impaired fasting glucose. That is a condition you are likely to develop diabetes in future. You may not develop diabetes as well, but you should be followed up by a doctor. That is the message you are given by that kind of impaired fasting glucose value. The other important thing is, if your fasting glucose value is below 60 milligram per deciliter, that is also not good. It is a kind of a serious condition, serious situation. You have to go to a doctor as soon as possible with the report. We call this kind of result a hypoglycemia. That is also not good. I think those are the things you should know, essentially know, regarding the test called fasting blood sugar. I think you gain something from my small video. Next time also I would come to see you with a kind of test which may be very important for you in the management of your disease. Thank you very much for being with me.